All righty then.
Hello, and welcome everyone to the New York State Alumni Association monthly meeting. My name is Wilvina Gordon, and I am the New York State coordinator for the Alumni Association. People are still joining, but we want to start this meeting on time. I want to introduce to you my co-host, Malik Hutchinson. And we're going to also introduce the rest of the steering committee, starting with our president, alumni of the Alumni, Albert Aponte.
Albert.
I'm trying to get on.
Girls are gonna be sitting over there if they come. No, this thing is long. You don't want to.
All right, you're on, Albert.
You're on now. We can see you.
Good evening, everybody. Welcome once again to this amazing group, of the Alumni Association in New York State. Like I always tell, my name is Albert Aponte. I am a SERPA. I'm the supervisor for peer services at Samaritan Daytop Village Outpatient Program. I'm also on the board of For New York. And I also co-chair for consumers at the Bronx Council on Alcohol and Substance Use Disorder. And I'm also on the Building Bridges Street Outreach Team for New York Council on Problem Gambling, amongst other things that, I stay involved with. We bring you this meeting, so you can stay connected. We got a lot of information, a lot of job opportunities. I want to thank Oasis because they're the ones that helped us start this. I want to thank ASAP because they're always on. Ruth Riddick, we love you. She's always giving us updated information in the SERPA field. And For New York for allowing us to partner with them and have these amazing meetings keep going, So with that, Louis, do your introduction, babe.
There you go. I just needed to unmute. Hello, everyone. First and foremost, let's have a moment of silence for those suffering through this pandemic and those that have passed away from an overdose. Thank you for that. My name is Louis LeBoy. I'm a person in long-term recovery. I'm a certified recovery peer advocate, an alumni of Phoenix House, in the steering committee for the Friends of Recovery New York State Alumni Association, the chairperson for the Bronx Council on Alcohol and Substance Use Disorders. I'm also a board member for the New York State ASAP New York Certification Board and the senior administrator of residential programs for Acacia Network. I'm a person in long-term recovery, and tonight we welcome all friends, loved ones, alumni, KSAC students, providers, peers, recovery coaches, stakeholders, consumers, and a very special welcome to all those with a history of mental health issues here tonight. The New York Alumni Association, the New York State Alumni Association is committed to empower everyone affected by the horrors of addiction, to assist everyone affected find and maintain a new way to live and to pass it forward to the vulnerable persons around us. As peers, we need to continue our relentlessness in providing the community with the medicine needed to recover. Through justice, equality, diversity, inclusion, and love for humanity. May our future continue to be filled with hope, unity, and love. Thank you. Back to you, Malik.
All right, thank you, Louis. So I just want to address some housekeeping needs. I want to address us all to the chat. I placed our QR code for our Alumni Association of New York State Facebook page. We would love to have you all befriend us if you haven't already. All you have to do is utilize the QR code that's in our the chat right now. I pasted it in the chat already. Don't worry. I took care of it, team. So you can just use that whenever you get a chance, and it will take you directly to our Facebook page, and you can join our Facebook page. We love and send it to whomever you want to send it to, so they can join as well, and they can get all the wonderful information that we have posted regularly on our page. So thank you again for joining us this month. The theme of our meeting this month is diversity and sexual assault awareness. Diversity and sexual assault awareness. Let's keep these things in mind. As Lewis says every meeting about having a motive but silence, let's also include those who, suffer from this as well, which is very serious. So we want to just have another wonderful meeting. We have a whole host of guests to come on. I'm a proud person in recovery myself. I'm a proud veteran. And I'm also on the ASAP certification board, as well, with Lewis, and any new peers or Serpas that are come on board. We're on that board to make sure that they're vetted. It's a total honor to be there. I also, I'm gonna say it this time, Ruth, she's on me. I advocated for veteran supported recovery a few years ago, and that's moving well. It's a specialty designation, another specialty designation for us peers, to really allow veterans, or those who are assisting veterans, also have a track to provide some good resources and wonderful resources to our heroes who have served our country. I'm looking for Ann. Ann, are you there? Ann, are you there yet? Is Anne Marie there yet?
I don't see Anne Marie, and I guess we could turn it over to Brenda to do the
yes.
To do the ATC acknowledgements. And you mentioned veterans. We do have a presenter today that's going to also talk about their veteran program. So
absolutely.
So Brenda, do you want to do the ATC recognitions?
Before I do that, I think we have other steering committee members that we need to introduce tonight.
Yes, we do. Thank you for that. We do have one of our newest steering committee members I want to introduce to everybody. Ira Weiss recently joined the Alumni Steering Committee. Say hi, Ira.
Hey, everybody.
Yes. Also,
Donut. Is he on?
I don't see him on at this moment.
He also is another one of our new alumni steering committee members. So we're growing. Welcome. So Brenda, if you don't mind.
Oh no, I don't mind. So just hello everyone. I'm so glad that you took out the time to join us. And today we want to just give a shout out to those who have joined us from various treatment programs. And we want to start off with the ATCs. And, really, this has been a real pleasure, because I'm seeing how the ATCs are growing because of this meeting, and how they are spreading the word to other ATCs, and they're coming on. And this is really important, that this meeting really helps individuals who are in early recovery transition. This is a support. This is a way of supporting one's recovery. Coming to this meeting, you're going to hear things, you're going to be inspired. And so I just want to give a shout out to those that are on today. So for the ATCs, I want to give a shout out to Stutzman ATC, which is in Buffalo, DVD, which is in Ovid, St. Lawrence, that's ATC, that's in Ogdensburg, New York, Norris ATC, that's in Rochester, New York, McPike ATC, Utica, New York, Ward ATC in Middletown. I see you on Ward ATC. Blaisdell ATC, that's in Rockland County, Orangeburg, New York, Bronx ATC, the mighty
Yeah,
Bronx.
Bronx. Yeah.
All right.
Bronx, don't forget that.
Bronx ATC, yeah, right. Kingsborough ATC.
Yeah.
All right. That's in Brooklyn, New York. South Beach ATC, which is in Staten Island. Creedmoor ATC, which is in Queens, New York. And CK Post, which is in Long Island. I see CK Post on.
CK Post.
All right. And do we have Elm Court in the house tonight?
Elm Gore, yes. They're duly diagnosed today, but they're
All
here.
right. And we want to shout, if we have Samaritan Daytop on, we want to shout you out as well. And thank you for coming on. And so we just want to give a shout out this evening. We thank you for coming on, and just continue to share it. Let somebody know that we are here, and that they can come once a month at the end, towards the end of the month, that we are on, and that they can come and be inspired just like you are inspired. So thank you again.
Shout out to Janice. We have Janice brother.
Janice is on, right? My co-laborer there, Janice is on.
Right.
Thank you, guys. I'm very glad to be here. I had a really hard situation today where somebody relapsed, and they had a long time clean. So I said, let me go to the alumni meeting tonight. And I'm an alumni of Samaritan, New Hope Manor, and Apple Manhattan Daycare Center. It took me a while, but I finally got there in 1986.
All right, Janice.
All right. Woo.
We love you, Janice.
We love you, Janice.
For anything.
It's great to see CK Post, because I worked there for 13 years and you guys make magic over there.
All right.
And also want to give a shout out to one of my mentors, Stephanie Campbell, who's always with us.
What? Stephanie's here. Hi, Stephanie.
Hey, Steph.
Hi, everyone. Good to be here. Good to see you all.
All right. So we wanna move forward. Dr. Angelia, she said she has a hard 7 o'clock. Dr. Angelia, go ahead and give us your.
I'm here. I'm intermittent with the camera because I don't want Zoom to crash. It already crashed twice on me just during this meeting. So we'll hold it out for Zoom. Good afternoon, everyone. Thank you so much for attending this. This is, like, for me, as it is for a lot of folks, it's always such a good thing on a late Thursday night, right? It's the best pre-Friday date you can have, is to come on here and get, filled with each other and all the camaraderie. It's the best meeting, right? I love attending the alumni meeting. For all of those of you who are at the ATCs, this meeting brings your face to the place, and it brings your voice into the rooms. And so we just want you to continue to feel welcome, to continue to show up here. And when you are ready to do a little more, you certainly get on For New York's listserv. We need you, and the movement. We need you to bring your voice to so that if we put out any surveys, you fill that out, so that whatever we say, it is backed up and it is vetted by the community, and it is really what the community say. And I've done so many things at For New York because of folks at the alumni specifically telling me and asking me to do. So every time we make any type of changes or program enhancement or program development, it is because people at the alumni have said, listen, we need this, I need this. And so we've adjusted to make those changes. With saying that, there's going to be an awesome program coming later this year. We will be seeking 4 program alumni leaders across the state. So stay tuned, stay close, so that when that opportunity arises, you can be in the mix and get nominated or whatever the committee decides, however they want to select. But that is something new, and that is something that is in the spirit of Willie Towns. Some of you remember Willie Towns, who has retired, but still calls me at least once or twice a month and says, "Angelia, what about this? Why are you not doing this? Why are you not doing that?" So I have to listen to Willie. We will be doing, we'll be looking for 4 peer leaders across the state who will assist with the Wovina and doing exactly what the Alumni Steering Committee has always done, getting into places where folks are needed to be and making sure that they grab people as they're in early recovery and give them that overwhelmingly support that is so needed. So what are we pushing? What are we talking about at For New York? Lots of things coming up. But like I say, every month, go to www.for-ny.org, sign up for the newsletter so you can get all the information. Yes, we kill you with the information, but you need the information. And so we have our very own Director of Communications and Social Engagement, which we've added to communications, Miss Melissa Fleck, which is there. Our brand new, hot off the press, Policy Director, Mr. Chris Assini, is also on. So they'll put their emails in the chat so that you can reach out to them and just let them know what's up, especially Melissa. She likes to hear from everybody. Trust me, if you reach out to her, she's going to try to put a meeting on her book for you, okay? Not just EO meeting, but she will meet you for coffee. She loves that. So certainly, reach out. We got a couple events coming up, but I'll let you go to For New York to kind of find those out. One thing that we definitely want to get out is about Daniel's Law. People often think that there's nothing they can do if they're not in Albany, or if they don't know certain people, or whatever the case may be. We are really, really pushing Daniel's Law across the state. We want that to become a law, and to make sure that law enforcement have the appropriate training when they are engaging with someone who may be under the influence of substance use, or may be in withdrawal and experiencing what appears to be a psychotic symptom. We want them to know that they are not equipped to handle that. And there are folks who are willing to team with law enforcement to ensure that no life is lost on behalf of individuals not being aware of someone who is experiencing a crisis due to substance use or withdrawal from a substance. So Daniel's Law, I will make sure that I get the information to Melissa, who can drop it in the chat after I leave. Melissa, I'll give you I think you might have the link. Okay, or if not, let me know, and I'll make sure that comes across. We're just waiting on the budget, of course, to be passed in New York State, like a lot of people, to kind of see where we land. Recovery Services is always in the need of, additional funding, as this is not just something that folks do out of the kindness of their heart, right? Individuals need qualified living wages to be able to continue to do what we all do. So we are waiting on that to see if there will be an increase, the COLA increase for human service workers. So I won't belabor anymore, because you didn't come to hear me. You came to hear all these wonderful speakers and all of this education. So on behalf of For New York, Board of Directors, and our staff, we say thank you. And I say you need to continue to be here every month.
Oh, Angelia, someone just put into the chat, if you could just explain a little more about what Daniel's Law is.
Yes, I will give you the skinny, and I'm talking real skinny, 100-pound skinny on this, okay? Daniel's Law, Daniel Prude was an individual in Western New York who was experiencing a crisis due to mental health, or may not be due to substance use. It has not been concluded, but he had an interaction with law enforcement that left Daniel dead, literally. Yes. And so, law enforcement, if you haven't seen the video, it was all across the world. It's on CNN. So I'm pretty sure if you YouTube it, you will find who Daniel Prude is who he was. With regards to, I say is because he still lives on in Daniel's Law, and it is important that we get Daniel's Law passed so that law enforcement will have the appropriate training or the appropriate people with them as they engage with individuals if they get a call for somebody experiencing mental health. And so for New York, along with NIAPRS, immediately after the Daniel Prude, we signed on to support NIAPRS, who has led this charge from the beginning. That's the National Association of Psychiatric Rehab, Harvey. They've led this charge, and it's been something that we've been also trying to definitely push, and now we're very, very, very close. And so we want to make sure that the legislators of New York understand that Daniel's Law is needed. That's the real skinny on it. And again, very, very skinny on it, but it is to ensure that no one else succumbs to law enforcement interaction as a result of a substance use or a mental health crisis.
Okay, so there are a few other very short announcements before we go on to the Oasis update. We want to make sure that people are aware of the SERPA conference that is going to be at Queensborough Community College, June 13th, 6 p.m. And there's also a hybrid version of that happening on the Wednesday, 9 to 5 p.m. Queensborough Community College is a beautiful campus. I used to be a professor there. I would encourage everyone to go. Also, the ASAP Jedi Summit will be May 19th at the at 208 West 13th Street, the LGBT Community Center. Beautiful renovated building from 8 a.m. to 4. So I hope Brenda and I know Stephanie is here, who is just going to do our Oasis quick updates before we go to Ruth Riddick.
Brenda,
So,
and then Stephanie too.
yep, so both of us will say something quick. So I just want to give an update to this group, a really great update in regards to some of the things that are happening with New York State Oasis. So one of the things that has taken place as of January 23rd, 2023, is that there have been rate increases for peer support services. This is something that has been asked for a very long time, and now we are actually seeing these rate increases. And so for outpatient clinics, upstate and downstate, you will find upstate, the current rate is $25.19. And that jumps from $17.02 previously to $25.19. Downstate, freestanding, 822 outpatient clinics, it went from $19.92 to $29.47. Those increases also include hospital upstate and hospital downstate, as well as outpatient 822 rehab, and the OTP treatment programs also have rate increases. So we are just grateful, because that means that hopefully this will translate. It's not a given, but it's our hope that it will translate to individuals receiving better salaries and closer to a living wage, right? So that's what we want to see with this. Also, not only has the rate increased, but the limit of how the number of minutes. So this is, you get $25.19 upstate per 15-minute units, but the units have been increased, and the units have actually been doubled. So it went from 12 units to you can do 24 units, 15-minute units in a day. That adds up to 6 hours that there can be receive billing for 6 hours per service date. And the important thing is that this does not have to be contiguous. So this doesn't, and can, so that means in 6 hours, it could mean that a peer will drop somebody to an emergency room, and then they may go do something else, and they'll come back, pick the person up, take them to another place, and then come back and get, so it doesn't have to be all 6 hours straight. It can be, as long as it's the 6 hours throughout the day, you can bill for the 15-minute units with a maximum of 24 units, 6 hours per service day. Yay! Yay,
Awesome.
That's
finally,
wonderful.
that we've been waiting
People
for
can
this
earn a
for a
living.
very long time. Pat Lincourt wanted to be here to share that with you, but I got to share it with you, so I'm really excited about that. This also, there are just recovery housing. So I just want to share with you another thing that's happening is that we are moving forward. Hopefully very soon, there will be a regulation for recovery housing, recovery residences that will Oasis will be having oversight over recovery residences in New York State. There is a regulation, it's called 860 regulation, that will be going out for public comment. When they go out for public comment, we need everyone to go on, take a look at it, make some comments. We're trying to, this is the first recovery support that is going out to be certified, and that there will be a regulation around. So we need to make sure that the recovery community knows about it, that they get to the opportunity to make comments on it. And so we want to make sure that you are aware. One of the things that we're trying to do in order to make sure that we're reaching recovery residences, sober living homes, halfway houses that are not certified by Oasis, we're asking the recovery community to share some of that information with us. So I'm going to put my email in the chat box. If you know of any recovery residences, sober living homes, halfway houses in your community, and you have the contact information, please share that with me. We're trying to make sure, we do not want this to happen without the people that it is impacting. We need persons with lived experience to be able to have feedback and to say, have their voices heard and how this moves forward. So I'm asking you to do that. I'll put it in and so we thank you for listening. There's a lot of other things that are going on, but I'm going to turn it over to Stephanie to share some of the things that she has to say.
Thank you, Brenda.
Thank you.
Thanks.
Thanks, Brenda. And
Thank you, Brenda.
You're welcome.
and good evening, everyone. Really grateful to be with my family at this beautiful meeting that I look so much forward to every month. And as Brenda said, what an incredible opportunity for there to be greater equity among payment for peer professionals who are doing this incredible work. So I'm really excited. I'm really excited about this. A couple of things that I wanted to just kind of give you guys a heads up on. I'm not sure if you've all been following what's been happening on the federal level with the Biden-Harris administration and them really trying to shore up Medicaid and expand Medicaid, but also, really keep, our population cared for. But there's certainly, I'm just trying to pull up here, something that we've been working on through CHAMP, and most of you know that I'm the director of the New York State Behavioral Health Ombudsman Office, which is also known as CHAMP, and we're working really hard on insurance issues pertaining to substance use and mental health treatment. And one of the things that the Biden-Harris administration did recently this week was to propose new standards to help ensure access to quality healthcare for Medicaid and CHIP. And as you know, There's been a lot of work that we're doing on network adequacy. I'm not going to go into detail on what that means, but broadly speaking, network adequacy is making sure that services rendered for behavioral health services, for substance use treatment and mental health are on par, equal with what is provided on the med-surg side. And so, there has been, for reasons that we all know in terms of stigma and discrimination against our folks, that there has been inequity. And so these standards are standards that we've been pushing for a long time. So one of the new standards is establishing certain appointment wait times for Medicaid and CHIP managed care enrollees. What that means is, currently, if you have someone who needs access to care, oftentimes there will be extensive wait lists, right? Expensive wait times for them. And so, so on the federal level, and we're doing this here in New York State as well, trying to work in tandem with our federal partners to make sure that there is stronger state monitoring and reporting requirements related to access and network adequacy for Medicaid and CHIP managed care plans. And network adequacy is one of those terms that applies to making sure that people who are members of a certain plan, whether it be public or private commercial plans, that the network in which they sign up for their benefits is adequate, meaning that there are enough providers within their in-network so that they can get an appointment and they can get access to care. So that's a real major win for us. And we're certainly here in New York State. I've been in a number of meetings with our colleagues over at DFS, Department of Financial Services, and Department of Health to ensure that those network standards are reflected here in New York State. Another thing that often happens with our folks, and if you're like me, you probably haven't read through that very large benefits package that comes in with your insurance plan once a year. And within that, within those documents is the provider directories, which are supposed to be kept up to date and current so that when you or a loved one is in crisis, you're able to look at your provider directory and you're able to get accurate information in terms of who is available in your network that would provide care. That often, unfortunately, does not happen. And so what the Biden-Harris administration has proposed is that it will now be requiring states to conduct independent secret shopper surveys of all the Medicaid and CHIP managed care plans to verify compliance with their provider, that their provider directories are up to date, and that they are compliance with appointment wait time standards. And that's a huge win too, because oftentimes, I get calls all the time, my team gets calls all the time about folks that are desperately trying to get access to care, and they cannot do that because the information that their insurance plan is providing is not accurate and up to date. There's also the creation of new payment transparency requirements for states that will be requiring the disclosure of provider payment rates, both for fee-for-service and managed care, with the goal in mind to provide greater insight into how Medicaid payment levels affect access to care. And again, these are terms that many of us don't know. I certainly didn't know it until in detail until I got into the role that I'm in now. But this transparency is so important because, again, it will inform regulators and also, consumers on what those, on what they are entitled to in terms of payment rates. There's also additional transparency for community-based services, and that's going to affect our community in particular, right? We need to make sure that payments for personal care, for home services, and for direct workers are transparent. And so that's also something that has been advocated for a long time. So I think this is, I could go on for a while. I know we've got a lot of really important people to talk. So I'm going to turn it back over to you, Wilhelmina, to talk for the rest of the meeting.
Yes, Stephanie, there is so much happening, and we've got like a really jam-packed agenda right now. We still have Ruth and Alton Wilson before we get to our other invited presenters for the night. So Ruth, I'm going to quickly turn it over to you. Thank you so much, Stephanie. Ruth, you're still muted.
Thank you, Wilvina. So, folks, what's it all about?
Recovery.
Yes.
Recovery, baby.
Yes, it's all about recovery. And that's what brings us here this evening. That is our shared mission. And we've already heard many, many different voices. We'll hear many more. And what we share together this evening, and we share together in the community, is our commitment to recovery. And it's my honor to be part of this community. So without further ado, I have two items to bring you this evening. The first is something that Wilvina mentioned briefly earlier. This is the third annual ASAP Jedi Conference, happening here in person in New York City on Friday, May 19. See it there. It's a great lineup. It's a really interesting set of speakers, set of presentations, and we'll get to network in person with our New York City colleagues and those of you from out of city who come visit us for the conference, for the summit, and who maybe want to stay for the weekend and have a weekend of fun in the greatest city of the world. So join us on the 19th for the third annual ASAP Jedi Conference. That's the first announcement that I wanted to make to you this evening. There's the register URL. I've put it in the chat box. The second piece that I want to bring you is more technical. And it is it's an opportunity and an invitation for community-wide participation. As you all know, the purpose of certification is to confirm competence. And competence is delineated or described or tabulated in role delineation studies. If you're a SERPA, there's a role delineation study that gave rise to that. If you're CARC, as I am, there's a role delineation study behind that. If you're a veteran-supported recovery professional, there's a role delineation study behind that too. And the last time I brought an opportunity to participate in the role delineation study process was for veteran-supported recovery. I'm sure I'm looking, Malik, at your head shaking vigorously here. That was 2 or more years ago, and you folks really stepped up. We need a minimum of 300 respondents to validate, to agree that the subject matter experts who put together a role delineation study on behalf of the community to validate that we got it right, that they got it right. In the current opportunity, we're talking about a certification which we've been asked about for some time, but again, by the community. Really, what are the competencies that a supervisor of peers needs to effectively supervise peers? It's a very simple question, but there's a technical process that gives rise to the answer. But you folks asked the question, and here's the process to answer it. And we're inviting you to participate actively by taking this validation survey. It's the first step in developing a certification, identifying the role, developing appropriate ethics, a code of ethics, and the certification itself. We're at the beginning of the process. We're inviting you to take the survey at this URL and tell us, are we getting it right? Are we getting it right, or are there some additions and amendments that we need to consider? Now, I have no idea what the answer to all of that is. We're putting our best shot for now out to you folks. You're going to tell us what you're going to tell us. And we're asking you to tell us that before May 26th. And just about everybody on this call is going to be eligible as a respondent, because you currently supervise, or you manage or oversee programs, or you hold a peer certification, or you have experience educating or training peer recovery professionals in supervision, looking at you, Connie Pacheco. So this is an opportunity for all of us to get on board and participate in literally in building the future of our field and making it better every day, all day, every day. So I'm going to put this URL, this web address, in the chat box and invite everybody here to just click through, take the survey, submit the survey, be part of the process. And thank you so much for your help with that.
I did mine today, Ruth.
Great stuff, Albert. Leading the way as ever. Thank you.
If you don't
Okay.
mind, Alton, if you don't mind, we have a guest that we'd like to jump on real quick. If you don't mind, let her go, because she has to go at 7. And then we'll let you jump on, if you don't mind. Lindsay?
I'm the guest. I'm so glad to be here. I want to take a second to say thank you to Ira Weiss for the invitation, and also take a second to say thank you to all of you for the warm welcome, and especially for the energy. I am really excited to be here. I did not 100% know exactly what kind of vibe I was going to be coming into, but I sort of love it. And again, I appreciate the invitation. So thanks so much for having me. My name is Lindsay Ragona. I am here representing CN Guidance and Counseling Services. Janice, I see you there. I'm saying hello to you. And I wanted to do 2 things with you today. The first is to describe our certified community behavioral health clinic, let you know what that program model is all about. And I'm really happy to have been following the conversation about what kinds of things are happening in New York Medicaid and federally in terms of moving the field forward, because CCBHC is a great example of how some of the best practices are coming to life and actually working to impact patients and help promote recovery. The other is an offshoot of that, and that is to describe our veterans program. Malik, I'm really excited to see you here again today. So I was so happy with our last conversation, and I'm glad that we're going to be able to have another one. Yeah. So a certified community behavioral health clinic is a model of care whereby a person who's living with substance use disorders and or mental health concerns, because I think we all know how often those 2 things occur together, right? So the CCBHC model is one where a person who is living with either or both can come to an outpatient environment and receive care that is right for them, regardless of the interplay between those two things. I know that in the past, a lot of people who were experiencing both of those things kind of got tossed around from place to place, and no, you can't come here because they are, you know, we're substance use and that's a mental health issue, or vice versa, we're mental health and what you're going through is substance use. So the CCBHC model is designed to stop that from happening, and we call that a no wrong door approach. Whatever it is that you have going on today, last week, next week, whatever, come to us. We'll work with it. We have staff that are trained and comfortable in both arenas. And so we really do take into account that no wrong door approach, and our type of clinic, which by the way is a New York, it's a federal program, but New York State is one of the participating states. So I know that this is a statewide meeting. Regardless of where you are in New York State, you should be able to find yourself one of these clinics. New York is very dedicated to this. So, and with that, I want to say thank you to the OASIS partners that are on there, because this is done in complement between the Office of Mental Health and OASIS. And so from the federal government through the state government, all the way down to the individual agency level, there really is that spirit of partnership. So when a client comes into our clinic, it is designed to wrap enough of the right kinds of services around a person so that no matter what it is they're going through, we can help you outpatient. Hope to avoid emergency rooms, avoid hospitalizations, hopefully avoid rehab if that's medically appropriate, and all of those sorts of things. We all know that whenever possible, an outpatient environment is better for a person when it comes to a lack of disruption in their lives and all of those sorts of things. So part of what we offer is medication assisted treatment. We do that for, and almost all of the CCBHC agencies are the same. We can do outpatient detox for alcohol, opiates, and benzodiazepines. So again, the hope is that we can have this in an outpatient. You can go home to your family at the end of your clinic visit. You don't have to necessarily spend days or weeks in an inpatient environment, unless that is what's truly needed, in which case part of this model is also partnership with other organizations, so that if we're not the best fit for somebody, we are partnered out there with somebody who is. So we have that ability to do outpatient detox with, thank you, yes, Stephanie, least restrictive care possible and appropriate. Thank you for the right phrasing. So I think we all know, especially in this forum, that along with that level of care, especially at the MAT pieces of all of that, comes really the importance of peer services. That is something that we implemented as a function of our certified community behavioral health clinic. We've got a really strong peer services program. We're really proud of it because we know, as all of you do, nobody knows better than you. That's very often the secret sauce, right? You can throw social workers at people all you want. You can get case management. You can get them hooked up with any of those things. But very often it is you guys in the peer role who really drive the point home and really bring that message of recovery. So peer services is a required part of this model. 24/7 access to care, especially for people in crisis, is a requirement of this model. And so is wrapping around the right level of care. We offer intensive case management. In this model, it's called targeted case management. We offer psychiatric rehabilitation services, which can look individual, anything from time management, self-management, skill building. We teach people how to use and get comfortable with technology, anything from there to pre-employment and employment supports as well. I see a couple of job coaches on the line. So all of that falls within our psych rehab piece of our program. And then the crux of it is mental health and substance use recovery. And so I wanted you guys to be aware, again, thank you to Ira, that the CCBHC model is out there. It is present in New York. It is gaining traction both in New York and nationally at both the legislative levels and within the grant world. And so when you are working out there with clients, think about this model because it turns on its ear all of the things that we are used to. Stephanie mentioned, or somebody, it may not have been Stephanie, if it wasn't you, I'm sorry. But the difficulty in getting access to care, the days or weeks that it can possibly take and too often takes to get people the help that they, thanks, you're like my best cheerleader here. Sometimes it can take days and weeks, and we all know that's not helpful when a person is ready for help today, right now, at this hour, right? And so please, when you are working with a person who is feeling that motivation, please consider a CCBHC because the model is by design and by requirement meant to help the people right now. I'm going to put my contact information in the chat. I can help, of course I will. I can help you find CCBHCs in your local area. New York's got a lot. We started out with 13, but now we're up to 60 or 70 and we're really working really hard. One of the pieces, so that's my statewide message. But I am also happy to see, oh, Samaritan, that's right. Congratulations, welcome to the CCBHC world. One of the requirements of the CCBHC model is specific services for veterans, active service members, and family members. So please be aware that for our definition, that can be anyone who has served or any family member of a service member. And it's an important distinction to make because a CCBHC can work with the people that do not meet the VA's definition of what a veteran is. So people with less than honorable discharges, people who served during peacetime, maybe a reservist, maybe someone who didn't serve long enough, CCBHCs can count them as veterans. So please do keep that in mind as well. In our veteran services piece of the CCBHC, and this is kind of a Long Island specific message, so I'm happy to see some neighbors here on the call, and also maybe the boroughs too. We're not so far from you guys. We're only about 20 miles east of Queens. We at CN Guidance recognized that our veteran services was okay, but we're not okay with okay. We decided that we needed to up our vet services game. And so we were lucky enough to get some additional funding to create a program to bridge the gap between the veteran community that we know, and again, I'm using the broad definition of veteran here, the veteran community that we know has a lot of need and is at risk much of the time, and the services that we know to be available in many of those areas. We noticed, like I'm sure all of you did, we've got lots of services and we've got lots of vets, but they're not always connected and they're not always receiving the things that might be a benefit to them. Nor do some people even sometimes recognize that there is a broader definition of what veteran is out there. And so we designed a grant program we call Bridging the Gap to bridge that gap. Guess what I did there? And we have hired a couple of really talented veteran thank you. We have hired a couple of really talented, really engaging veteran outreach specialists. They have been there. They have either worn the uniform themselves or are a family member of someone who has. And so they have the ability to connect directly with that community in a 100% no pressure way. Our program is designed to fill in the holes that are left behind when people access whatever services they are aware of. It can mean any number of things. We can facilitate connections to other organizations. We can find you a contractor if you need your roof fixed. We can very simply offer peer supports to the veteran community and the family member community. Everybody in this room knows the value of that. And so it is a peer-led service for people who, with the veterans community as a peers. We can offer connection to any number of things. The ultimate goal of the program is to save lives by reducing loneliness. We know that veteran suicide is a problem. We hate it. It hurts our hearts. And we know that loneliness and isolation is a huge contributor to that problem. And so we have designed this program to be able to help fill that gap and really help people get connected to the community. If that looks like substance use connection or mental health connection, great. If it looks like we can get you hooked up with a VSO because maybe people have that old school definition of what a VSO is, great. If it looks like we are the ones who have a conversation with you just because you haven't had a conversation with somebody in a long time, we're here. And so, especially for our Long Island partners in the room, and again, maybe the boroughs, I would appreciate it if you would keep us in mind. We are fairly confident at this point that we've got the right idea, right? We've talked to a lot of people out there, a lot of organizations, but I gotta be honest, it isn't always easy to connect with the veterans themselves. And so I task all of you, I see a couple of you nodding, so I appreciate that validation. I would appreciate if you would keep us in mind. You may not be a veteran, but you may know someone who is. You may, the veterans that you work with may be well connected and feel like they have a really strong quality of life, but maybe they know someone who isn't. I know that within this community, word of mouth is really our strongest thing. So I would ask that you would keep us in mind, especially on the island, because we are dedicated and passionate, and this community is one that needs our help. So I've got a couple of extra minutes.
Well, actually, yeah, because we actually have several other people there. If you could put all of your information, and you know, the Alumni Association has an email, we've got a website, we would love to be able to link to you guys. And I also believe our communication director wanted to reach out,
Great.
Melissa Fleck, specifically to you. So thank you so much.
Great. Guys,
Lindsay,
I appreciate your time and your attention. Thank you again so much for having me. I'm gonna come off of camera, but thank you again. I'm gonna just take a couple of seconds to put my stuff in the chat, and then I'm gonna dip. But again, thanks so much.
Thanks,
Okay,
Lindsay.
Lindsay.
Alton. Thanks.
Thanks, Lindsay.
Thank you very much. Alton Wilson here. Appreciate the partnership representing Acacia Network. So we have job opportunities, as I mentioned last month. We did get a big grant, and we're still looking to hire facilities in Bronx, Manhattan, Queens, and Brooklyn. We're looking to fill our residential recovery programs, as well as our CCBHC sites. And we also have some openings upstate in Buffalo and Albany. If you look in the chat, I put my contact information in there. And we also posted our positions on the For New York alumni jobs page. So don't forget to check that out. And typically the SERPAs are paid $45,000 plus full benefits. And then we have our KSAC positions that pay $65K plus their union positions, and they get, you know, the union increases every year and plus excellent benefits. So check us out at acacianetwork.org, or you can send your resume directly to me or to one of the leaders here on this monthly meeting. Thank you so much for allowing me to share. Bye-bye.
Thanks.
Okay.
Thanks.
Thank you, Alton.
Short and sweet, Alton. All right, moving right along, we have Josh Lowe, Paths to Jobs, who wants to come on and just give us a very quick update before we get to our presenters.
Yes, I will be very brief, and I appreciate the opportunity. Thank you to Ms. Gordon and Ms. Fleck for giving me the opportunity to speak with you all. Before I say anything, as a veteran, I just want to firstly say thank you to your service for any veterans that are in the chat at the moment. And to all of you, thank you for everything that you are doing for the veteran community, and a special little Semper Fi to any of my Marine family that might be listening. So very briefly, Ms. Fleck and I have been speaking. Yes, sir. Ms. Fleck and I have been discussing some of the collaborations that my organization, Path to Jobs and For New York, can do in terms of peer employment support and placement, as well as job retention and anything that involves career development. That's what we're in the business of doing, and getting certified peers out there giving back to the community and regaining that financial independence and that ability to influence others to do the same. So I can drop my information in the chat, but I will be working very closely with Ms. Fleck so we can kind of figure out what that collaboration is going to look like, because we want to get our SERPAs, our CARCs, our CASACs as much support in their career development as we possibly can. So thank you all.
Thank you.
Thank you.
Thank you, Josh.
Yes, so as we mentioned before, this month is Sexual Assault Awareness Month, in addition to Diversity Month. And our next presenter is from an organization that I have is near and dear to my heart. I have a personal experience with. I am a survivor of domestic violence, and it's extremely important for those who are here, for any people that are in treatment right now. We asked Wilda Cabrera to come on and to give us a presentation about the services at Safe Horizon, which is an incredibly important service that's available to everyone. So Wilda, thank you so much for coming on tonight.
Hi, everyone. Thank you for inviting me. My name is Awolda. I do have a PowerPoint. I'm not sure if I'm able to share it.
I think I did co-host you. Let me just double check that.
Okay.
I just did. I just
Okay.
spoke to partner. She can do it now.
Okay, thank you. So before I show my PowerPoint, let me just introduce myself. My name is Awolda. I am a manager for the Crime Victim Assistance Program for Safe Horizon. I supervise the Bronze Special Victims Division. So I mostly work with survivors of sexual violence now, but I did used to be an advocate at the precinct who worked with domestic violence survivors too. So let me share my screen. Give me one moment. Are you able to see that?
It started sharing.
Okay, now we could see it.
Okay, thank you. Thank you for letting me know. Okay, let me see. Oh, I'm not able to. Oh,
Yes.
here. Okay,
I show.
I'm sorry.
It's okay. It's okay.
Here we go. So I am going to be talking about domestic violence just to increase your awareness about what it is and how you can support someone who's going through it. So some considerations. So these are some of the considerations before I start, such as everything we discuss here stays here. You're encouraged to participate if you want. I do encourage you to be very respectful of each other's vulnerabilities. Speak from the eye, feel free to ask questions, and self-care. Okay, so some of the terminologies, I know most of you know what domestic violence is, but I just wanted to provide more information, such as that domestic violence is commonly known as intimate partner violence, family violence, or dating violence. Those involved and the person who caused harm is sometimes referred as the opposite party, perpetrator, abusive partner, offender, and others, as you can see. And then the person who's harmed is sometimes labeled as victim, survivor, or person that was harmed. In Safe Horizon, we do take pride in saying that we are very client-centered. So we like to refer to clients as how they want us to refer to them. So we do take a we do pay a lot of attention to our language, such as, for example, using the label victim can be very offensive and demeaning to some survivors. And we know that they feel that they can be perceived as weak and unfit if we use that word. Also using the word survivor. I know I do refer to clients a lot by survivors, but I also understand that people might not always feel as if they resonate with the strength and perseverance associated with that label. So that's something that is important to know. Okay, so what is domestic violence? So domestic violence is a pattern of behavior. Let me move this here. It's a pattern of behavior used by one partner to assert and maintain power and control over another partner in an intimate or dependent relationship. I am not going to go through all of these, but it's important to know that these intimizations can be committed by an intimate partner, such as a current, former boyfriend or girlfriend, and it can also be perpetrated by a family member, such as the parents, children, or siblings. Also, it is a pattern, so you might have someone who experienced different couple of incidents, but you might also have someone who only experienced a one-time event, and we also consider that domestic violence. Domestic violence is not a disagreement or an anger management problem. Domestic violence is abusive, disrespectful, and hurtful behavior that one intimate partner chooses to use against the other person. And you can see some data in the bottom, such as 1 in 4 women are abused and 1 in 7 men. I know it's a lot of information, I'm sorry. I just wanted to go through all of it, but I'm sorry, I know it's a lot. Also, you might also see people referring to domestic violence and using 3 terms interchangeably. And we do want people to also recognize that these terms are different, and we want you to know the difference between them. So domestic violence refers to violence such as assault, battery perpetrated in the home against partners, children, and elders. It also includes sexual assault, and it also includes physical damage to property or pets. Intimate partner violence, in the other hand, refers to violence between intimate partners, including LGBTQ plus couples. And lastly, domestic abuse refers to other forms of abuse that are not violent, but are just as damaging as physical violence. And this includes verbal abuse, economic abuse, social isolation, financial control, emotional and psychological abuse. And always remember, a person does not have to be hit to be hurt. And sometimes words hurt more than any physical actions. So that's something important for us to consider. I'm sorry, my daughter's here. So let me go to the other one. So I am going to go through some of the tactics that we see in these cases. Some of those include, I am sorry. Okay, bye. Bye, see you later. So some of the tactics include hurting the victim physically through slapping, pulling hair. I'm not gonna go through all of them, but you can see them here. There is also verbal abuse, using children against the partner. We commonly see that in custody cases, then calling victims names and hurting them emotionally, harming victims' pets, acting with extreme jealousy and possessiveness, isolating the victim from the family. Hi, Robert. I know you have a question. Can you save it for the end, or you want to ask it now? Okay. Let me continue going. Then also stalking, demanding sex or wanted sexual practices, minimizing their destructive behaviors, such as not taking accountability for their actions, controlling them with that certain look or gesture, and others, as you as you can see here. So I am going to go through some of the warning signs that you can see in these cases, and hopefully by learning about that, you can support someone who is going through domestic violence, and you can step forward and be that person for them. Or I'm not saying that you are, but if you are going through that, maybe that can help you increase your awareness about what's happening. So people who are abused may seem afraid or anxious to please their partner. They might always be vigilant to please partner at home or in the company, receive near constant calls or texts from their partner, go along with everything the partner says and does, are reluctant to or cannot socialize outside of work or on weekends with other partners. Usually they check in often with their partners to report where they are and what they're doing. They might receive frequent harassing calls from their partner. They can also talk about their partner's temper, jealousy, and possessiveness. And you can also see cases in which the survivor defends the abusing partner. Some of the warning signs for physical abuse include making excuses for the visible injuries and attributing them to accidents. So you can pay a lot of attention to facial injuries, such as bruises, cut lips, black eyes. Also, you can pay attention to maybe like if that person's missing work, not going to school, or social occasions without explanation. And also like the way they dress, such as if they're wearing like long sleeve clothes during the summer, sunglasses indoors. And then isolation is also another part of this cycle. And some of the warning signs for isolation include people, I'm sorry, I'm not able to see this. Include being restricted from seeing family members and rarely going out in public with other partner. Here are some psychological warning signs too, such as having a very low self-esteem. Even if they used to be very confident in the past, showing significant personality changes, and being depressed, anxious, or suicidal. During pregnancy, we can also notice some warning signs, such as late entry into prenatal care, your maternal age, history of abuse and or assault, unintended pregnancy. Then there are also warning signs for mental health, such as history of suicide attempts, depression and anxiety, unhappiness about being pregnant, and substance abuse. During the pandemic, I know that we were all in our houses and we couldn't go out and socialize as we used before. So in this time, we do know that survivors of violence face an even greater risk to their safety. Across all our programs, our advocates were witness to a high financial stability, growing numbers of male victims of color, increasing rates of elder abuse, greater need to work around the clock. And that's the end of the information I wanted to provide about domestic violence. I hope that you were able to learn something about domestic violence so that way you can support someone. I do want to provide a little bit more information about Safe Horizon as a whole. So you can see here that Safe Horizon supports over 2,500 survivors. So 250,000 survivors per year. And we provide safety, support, connection, and hope. We do have 3 main hotlines, which is very important for you to know. So we have a domestic violence hotline for shelter. We have a rape and sexual assault hotline, which you can call if you want information about how to report a sexual assault. And then we also have a crime victims hotline, which you can call if you are a victim of a crime and you need support knowing your maybe your rights, any services that you're eligible for, or anything else. We also have shelters. We have 8 shelters across 5 boroughs. And we also have different other programs, such as community programs, courts, drop-in centers, police precincts, child advocacy centers, and legal services. I do want to say that we do have 2 advocates in each precinct. So if you go to a police precinct to report an incident, there should be an advocate from Safe Horizon there who can be with you through the process, or if they're not there, they are usually going to call you after you make a police report for a domestic violence incident or for a crime.
Awesome.
And then into resources, and then here is how you can help, such as recognizing signs of domestic violence, and spread awareness about this important issue. I do have some information here for you to contact us if you need support. So here's our hotline, 24 hours hotline. You can always call 311 if you want to be connected to us. And then there's also other hotlines here. Now I can take questions. I'm sorry, how do I get out of this? I never shared my screen
All
before.
right, hold on. Okay.
Okay. Okay, hi, Robert.
Hi, so actually a few questions here. The hotlines, are they national hotlines or just for New York City residents?
So the domestic violence hotline we have is for New York. That's the
New York.
that's the hotline for New York.
And that's a 24/7?
Yes, that one's 24/7. All of them are 24/7. So
Okay,
the 3 hotlines that I provided, all of them are 24/7. And if you call one of them, they can connect you to others. So if you call the DV hotline only, we all connected. So if you call one, they'll can direct you to other programs.
gotcha. In the first slide, you had something about an I. What were you referring to, if I may ask?
A black eye?
No, the letter I.
I think you said keep it in the eye.
Keep it in the eye.
Keep it in
Keep
the
it
eye.
Oh, give it. Oh, yeah.
Don't
So
shoot
that
in
means
general.
that means like being personal about what you share. So if you're gonna share something, using the I, like I, talking from the I, as if like talking about yourself and not like making assumptions about other people.
Okay, the other thing I
Now,
want
wait,
to share.
Robert,
I'm
I'm sorry to cut you up because we do have one other presenter
Okay.
also who is another domestic violence presenter from the Harlem community. And I want to just make sure to give her the same time. And then if we have questions about that entire topic, you know, if they both have time to answer. So I'm sorry for cutting you off, Robert, but I did want to also take this time to introduce Christina Perry from WARM. She is also from a very important agency in New York. I'm going to let her share at this time.
Any questions could be put in the chat.
All right, thank you.
Thank you, thank you.
Thank you. Thank you, Lavina, and hello, everybody. My name is Christina Perry. I'm the Director of Operations for WARM, which stands for We All Really Matter. And we're a domestic violence organization based out of Harlem. And this organization was founded by Stephanie McGraw in 2011, where she actually was putting this organization together through a church basement. And through state contracts and funding, we were able to get a space here at WeWork and have been operational with staff since 2019. I want to say thank you to Awilda for explaining domestic violence. So I can skip a whole lot of that stuff and really talk about what WARM is about. And, you know, right now, WARM is the critical response team. We partner with 20 NYPD precincts in Harlem and in the Bronx. And what makes us kind of stand out is, you know, when there's a critical case, a homicide, a victim in the home with the abusers there, and the police call, they call our hotline, they call us, and we respond. You know, with police escort, we get the woman, the victim out, with children, without children, and we bring them here to our office, that safe space. We have a partnership with URI, where they have about 19 shelters where we're able to place our victims directly from the abusive situation directly into shelter. And we get to do that by bypassing the PATH program. And if anybody knows about PATH, that's the HR, that's a human resource organization. It's DHS. It's a long wait time to get shelter placement. And we have been blessed to bypass that whole thing for our victims. So that gives them a little bit of relief, stress-free when they're making that transition from abuse to empowerment. A lot of services that WARM provides, we do mental health and legal referral counseling. We work with our clients on getting their HRA applications done right here in the office. One-shot deals when they get their apartments to pay for the rent, security, the broker's fees. We do NYCHA applications. We do emergency transfer applications. We change the application, upgrade the application from doubled up or homeless to DV priority to get them moved up on the list. We're partnered with OVS out of New York State, that's the Office of Victim Services, where they fund WARM, and we're able to do these services and receive funding, change locks, to pay for funerals and burial expenses. In East Harlem, just last week, we lost a woman that lived in my community. Her name was, I can name it now. Her name is Marisol Duran, and she was stabbed multiple times in front of her children. And WARM, showed up within 24 hours. We did a candlelight vigil. I was in contact with the surviving family. We got the funeral paid for within 24 hours, and the service is this Saturday. So we're boots on the ground, we're critical response, and we get out there and we help these families. And we do that, through the help of funding as well, most importantly. In that funding, we're able to buy clothes and food, diapers, services. There's so much we do. Other than that, in the office, we bring these women in and they can have their virtual court hearings here for ACS, for family court, custody hearings. We do ACS visitations here, supervised and unsupervised, and surrogates court. We have a lot of clients that's fighting in surrogates court, and we're there. We go in person, we escort, we have vehicles, and we pick up the client and take them there and bring them back home. So WARM has grown from just one person of Stephanie McGraw to a team of 12. And, and we work so hard every day. Education, other than services, we provide education. Every Monday night at 6 p.m., we have a women's spiritual topic meeting that meets from 6 to 8. We also have a men's accountability program on Monday nights that meets 6 to 8. And that partnership came through Exodus. The population is predominantly abusers, some parolees, and that's been very successful. On Wednesday evenings, we have a women's wrap, and we also have a 12-week DV certification program. We have an 8-week PTSD and trauma program, and it goes on and on. We spend a lot of time with workshops, a lot of time educating the women and keep them engaged here at WARM. So I'm very glad to be here. This is a very exciting platform, and it's near and dear to my heart for one reason. I see Acacia here, and on a personal note, was a graduate of the outpatient for Acacia in 2019. So it's great to see Green Hope, represent a Green Hope here. Through God's grace, I'm here. I'm in recovery. I have 3 years and 5 months and 1 day. So it's really an honor to be here on a professional, personal level. So thank you. Thank you all.
Thank you. Thank you very much.
Thank you.
Well, thanks so much, Christina. And,
Yes.
especially if there's anybody sitting there in treatment who's going to be released and afraid to go home or has issues there, this is one of the reasons we wanted to make this information available to everyone on the platform. So thank you so much for that.
Christina, post your information in the chat, please. Thank you.
So
Yes.
I'm not sure if we do have time for questions because I believe we have one other speaker,
Ravina,
Charles Dawson. Yeah.
we lost you there for half your conversation.
Say again?
That
Repeat
was
what?
you, Albert. She's good.
She's good. We heard her.
Eva.
Okay, so, do we still have do we have time for like one or two questions? I know Robert had some other questions. Or should we go on to Cheryl?
Well, we got 5 minutes. We could take any questions they got for them right quick.
All right, Robert, did you get questions answered? Do you have any?
I didn't have a question. I want to make a comment, which is overlooked by a lot of people. Because I work on a warm line myself. I'm just not making a presentation tonight. When a lot of people go to a DV shelter and a woman uses her phone, what you don't realize is that's an open invitation, because there are programs that stalkers can use to find out the location of the phone from the phone. There are ways to avoid that. The people have to call their cell phone companies, tell them that they're now in a shelter situation, which can be easily verified by the local police department. The cell phone companies can use their security methods to make sure that it's not tracked at all by anybody. That's all I wanted to let you know, because it happens a lot. You say, how on earth did they find out? You use your cell phone. As soon as you use your cell phone, that's how they find you. I just wanted to let everyone know that there are ways that cell phone companies have of stopping that from taking place.
Well, thank you so much, Robert, because yes, stalking is definitely an issue that people need to be aware of through location tracking. So we are going to, at this time, move on to our next and final presentation. Before we go on to ATC recognition right now, we have a diversity speaker who I do see on the line, Cheryl. Where is Cheryl? Do you have your camera on right now? Hold on. Cheryl Dawson, are you here? Can you unmute? All right. Okay, we may
Don't
have.
see her.
Okay, yes, she was on earlier. I just want to say, ladies, thank you
Oh,
again.
I see her. Sorry,
Okay.
she's at the bottom, but she has her camera isn't showing for some reason. Cheryl?
Cheryl, are you prepared to do your presentation? Okay, I see her here.
She must have stepped away.
Okay.
Let's
Well,
move.
okay.
I'm here.
I'm
All right.
here.
Okay, can you
Come
turn
on,
on your
Cheryl.
camera?
I'm trying. I'm very new to this. This is my first time. Actually, I got a call yesterday from one of the employees from Green Hope for Women, who asked me if I would join in on this, and I'm very glad I did. And I think I might have my camera back. Oh,
Okay.
nope. I am also a member of the LGBTQ community, and I think that's why they asked me to speak. I'm not really sure what it is.
Well, this is Diversity Month. So
I don't know where my camera went.
That's okay.
we can hear you.
Okay.
We can hear you.
Yeah, probably without the, yeah, you can always hear me.
There you go. There you go.
Am I on?
Yep.
Yes.
Okay. I'm actually down in Atlantic City right now. That's where I'm from. I'm out walking my dog. But yeah, like I said, I'm a member of the LGBTQ community. I am an alumni of Green Hope for Women. I was there in 2018 to 2019. I stayed there for 18 months actually, because COVID happened while I was there and there was no movement. And I just wanted to share. One woman spoke about how challenging it is to get into treatment sometimes. And like I said, I'm from South Jersey, so I know very well how challenging it is. That's how I ended up in New York, because that was the closest place I could get into, and they took me immediately, and I'm very, very grateful for that. And like I said, I've been clean since November 24th, 2018. And I don't know what I'm supposed to be doing, but I will be glad to come back next time.
That's fine. Well, you know what? We do have for June is LGBT month at that point. But we're happy you were able to come on, Cheryl, and you know, diversity 100% matters, whether it's you know, ability, age, race, sexual identity, and so forth. So we appreciate you. And we do have, I guess, time. We have like several ATCs right now that that are waiting and chomping at the bit. But wait, let me just make sure, because I believe we also have a peer presenter, John Kay, before we get to, is John Kay in the house?
What's those ones?
He's logging in right now. He's having a hard time.
Thank you, Wilda. Thank you so much for coming.
Ya tengas.
Gracias,
Okay.
Wilda.
Hey, de nada. Have a good afternoon, everyone. I mean, good
Okay.
evening. It's already.
All right. Bye-bye.
Sorry.
Hey,
So should we go to the first ATC while we're waiting for John to log
Yeah.
on?
yes.
Yeah.
Okay,
let's
so
keep it
without further ado, we're gonna pass it over to the Bronx ATC, the Mighty Bronx. Let me see where you guys are right now. Oh, here you are, Pierre. Hold on.
Hey, everybody, how you doing?
Hey, Ron.
My name is Ron. I'm a counselor here at Bronx ATC. I'm also a person in long-term recovery since March 9th, 2014, man. I want to thank everybody for what you're doing. It's been very informative today. And I think I speak for everybody. When I say, how about the Knicks, huh? How about the Knicks?
Yeah.
So,
Yeah.
I don't want to take any more time. We have 3 presenters tonight, and the first one is take it away, Mr. Jazz B. Go ahead, Jazz.
Yes.
Yeah, there we go. Whoa, in the still of the night, how I held you tight, 'cause I love.
Yeah, I guess he's singing.
Promise I never let you go in the still of the night, in the still of the night. I remember, then I remember the stars were bright above, and the hope and the breath to your breast is love before. Oh, love, hold me again, boy, with your mind in the field of the night, in the field of the night, in the field of the night, in the field of the night.
Awesome.
Yeah. Yes. Woo.
Yeah.
Wepa!
Hey, knock that off. Stop, please. Welcome, Cecilia.
Cecilia.
Woo!
I have a poem for you guys. I see the flowers have bloomed. I am nearly accomplished at what I can do. As the air is frugal and my intentions stay true, to do my best and feel my best too. It is not a facade if I can still achieve. The hard part is only I know what I need. This is my test as they bloom, these flowers, and once a year, beauty rejuvenates this power.
Amazing.
Thank you so much,
Nice
Cheryl.
job.
All right.
You did your thing, girl.
Great job.
Play
We have one more. So let's give a warm Alumni Association welcome to Krista.
Yeah.
Dale, papá.
This is a song that I wrote for my mother. I usually do it on the guitar, but it doesn't work on Zoom, so I'm gonna do it on the pillow. I grow up, I wanna be like you, strong on the outside, loving to attempt to evolve every single way, all through the dark nights and through the troublesome days. And then you said to me, no, you can sing, no, you can dance, no, you can play songs, you give it a chance. No, you can love, no, you can give. Most of all, you want me to live. Mother, no, mother, she loved me too. Just like a butterfly, fresh new wings, sent to take flight, do all sort of things, never tend to land, unless it's somewhat promising. Say it to me, no, you can sing, no, you can dance, no, you can play, as long as you give it a chance. No, you can love, no, you can give. Most of all, you want me to live. No, mother, hope that you proud me to. Say I can sing, say I can dance, say I can play, as long as you give it a chance. Say I can love, say I can give. Most of all, you want me to live. Ooh, want the same for you. Ooh, I want the same for you. Oh,
Cristóbal!
Yeah.
Woo!
Ah,
Beautiful!
All right, then,
thank you, bro.
we'll see you next month.
Botaste, nene.
All right, Bronx.
Hermano, Bronx ATC!
Woo-hoo.
Woohoo!
Mighty Bronx.
Mighty,
Okay.
mighty Bronx AT.
Next up, I believe that we also have CW Post with a guitar performance that we want to hear. Are you ready, CW Post?
CK Post, yes.
CK Post, I'm sorry.
That's okay. Can you hear me?
Yes, please introduce yourself. We can hear you. You are pinned right now.
My name is Andrew Mulligan, and I am currently in treatment. I got about 40 days sober.
Woohoo!
Congratulations.
I am completing on Tuesday, and I am going over to the CR, looking to get back to life. I'm just going to play you two quick classical pieces that I like. One is by Randy Rhoads, and the second one I wrote here, and I simply call it Hope. So I hope you enjoy it. Thank you, everybody, for having me. All right.
Awesome.
It's coming from?
Thank you.
That was beautiful. Thank you so much.
Wow.
Yep. I was in a Mustang right now, riding through the mountains. That took me there.
Amazing.
Is John K on?
I don't think he was able to call in or log in. He had problems constantly.
Okay. Okay, well, this is the, I guess, the open discussion portion of our meeting. If we have questions, comments,
Burning
any,
desires.
yeah.
And just to commend you, Wilvina, you pushed the envelope, you pushed it, you pushed it, you pushed it. We have 19 minutes to spare.
What?
Listen, I
Go
just
ahead,
want to
girl,
mention,
coordinate.
yeah, one announcement. The Bronx Council on Alcohol and Substance Use Disorders will be hosting a health fair May 19th on 147th Street between 3rd Avenue and Willis Avenue. Everyone is welcome. If you would like a table, contact myself or Albert Aponte. I will put my contact information in the chat box. All are welcome.
It's from 11 to 3, but we start there at 8:30, 9 o'clock. You know, if you want a good spot, get there early.
Well, thank you guys. And, you know, once again, like I said, if anyone else wants to just check in, if they have any comments, people that came on that didn't get a chance to share anything. Go ahead, Malcolm.
Hello, good evening, family. How are you? My name is Malcolm. I'm a person in recovery. And we just celebrated 17 years in March.
What?
And,
Woo!
yeah, to me, that is a miracle. It's a miracle. It's a miracle. I thank God. I thank my mom. I thank my predecessors. And I just want to give a shout out to the Mighty Bronx ATC. Lovely, lovely, lovely performance by Jazz, Cecilia, and Cristobal, and also CK Post. Beautiful, beautiful music. Thank you, Ronald, for holding it down. You know, I want to motivate all the people in this meeting and all the newcomers, especially the people in treatment right now. You know, there are so many ways that you can be in recovery today. You know, so many resources. And this is one of them. You know, every month, you know, you're welcome. We give you the information to join from your home. Somebody was just walking their dog. Somebody, you know, who presented was walking their dog. This is how we do it. We stay clean one day at a time. So we want to encourage everyone who's going home to going to another program. Come here on the last Thursday of the month and join us. And we got open mic at the end. It's open mic, baby.
Yeah.
Donna, I love you. One love. Donna is an alumni. He's a Bronx ATC alumni who comes every Sunday to the Bronx ATC. And he has also been joining our monthly New York State alumni. This is living proof right there that it works. You know, it's a miracle, you know, to be in recovery. And I want to thank everyone who is in the field of addiction, serving this population, domestic violence, you know, all across the board, our veterans. Thank you. Thank you. This is a loving service that we're doing. And I couldn't do it without you. Thank you for letting me share. Thank you, Dawn. I love you.
Yeah,
Victor,
appreciate you, man. Congratulations on your 17 years.
Thank you. And I also want to give a shout out to Ganesh. Ganesh just completed the Bronx ATC and he's here with us. Ganesh.
Yeah.
Ganesh, welcome.
Coming.
Thank you so much for coming. And also, I want to say Donna is also one of our newest steering committee members to the Alumni Association. And he's thinking about you guys and providing some packets and resources and really, you know, keeping all that up. Albert had his hand up. Go ahead, Albert.
Yes, I want to remind everybody that next month for the Alumni Association of New York State meeting in May, we will be joining the recovery gems. So we're gonna be transmitting with for New York.
So we'll
So
make sure that you get the information. It starts at 5:30.
right,
Yeah,
right.
maybe some
Yes,
people
we'll
need
be
to
a
know
half hour
what
early
Recovery
next month.
Gems is. What is Recovery Gems?
So it's the annual awards ceremony for those people who are considered recovery gems according to For New York. And it's a ceremony where people are nominated and they receive recovery gem awards.
It's
Thank
award.
you.
There's only one award given to somebody that's done outstanding in politics and everything that supports recovery. And also they do a spotlight, on somebody else, or organization. So I think it was like 2 years ago, Lieutenant Governor Hochul won the Recovery Gem Award, and the Alumni Association of New York State got the spotlight. So we all got a certificate, so this year, and so since then, we've been teaming up with them, and so our meeting will be focused more on that. So it's gonna start at 5:30, right?
Yes, and there will be entertainment.
Yeah,
So
Yeah.
and
come out,
it'll
there's also
end
entertainment.
at 7:30, but we'll probably wrap up the same way we're doing now,
Right.
With the extra time if we have it. we'll
And
be
I
able
don't know how, but I was chosen as the honorary chairperson to speak there, and present the award. So, oh my God, it's gonna be amazing.
Congratulations, Albert. You're a winner.
Woo-hoo!
Okay,
right
yeah,
person.
we got two more hands up. Mighty Bronx and then Connie Pacheco.
Hey, everybody, real quick, we miss you, Malcolm. We just wanted to say something to you real quick. We love you.
That was sweet.
Woo, love you.
Love you too. See you tomorrow.
Thanks for the shout out, you
baby.
guys. All
Connie,
right, Connie.
Hi, guys. So just quick announcement. Am I still here? Sorry.
Yes,
Yeah.
yes, you
Oh,
are.
okay. Okay, because I was on my phone and then back. Okay. So quick announcement, just wanted to let you guys know that I'm coordinating the Bronx LGBT Expo, which is scheduled on June 15 at Lincoln Hospital. And we're very excited that we're doing it and collaborating with Lincoln Hospital. So please, please, please ask your agencies to table the event because we are looking for tablers. The LGBT Expo, the first part of that is a panel of speakers, and this year we're doing HIV, bisexuality, and for the first time, the peer recovery movement in the LGBT community. So we're very happy
Yeah.
we're going to see how that turns out. And then the second portion of that, of course, is going to be the drag performance. So if you or anybody wants to perform, please let me know. It's going to be a spectacular show. You don't want to miss it. It has been phenomenal in the past, and I'm sure that this year is going to be just as good. So again, that's June 15 from 1 to 7 at Lincoln Hospital. If you're interested, please send me an email or call me at 917-265-8090.
Okay.
you should
I
post
am
it.
definitely interested, Connie, so I definitely want to be there as well. All right. I know.
Connie, you should post it in the information, you should post it in our Alumni Association, the Facebook account. Send it to Albert. He'll post it for you.
yeah.
And also, Dr. Brown has been posting
Okay, will do.
multiple things in the chat about some other workshops and things that are happening. Dr. Brown, I don't know if you want to take a second and talk about that. We still have like 10 minutes.
Good afternoon / evening, everyone, depending on where you are right now. We have a event coming up on Saturday, May 6th, a all-day symposium developed by peers, for peers, and other professionals and non-professionals on the topic of substance use and mental health recovery, perspectives for consideration. All are welcome to attend. It's going to be a virtual event. All of the information is in the flyer that is posted in the chat. For more information and to RSVP, the information is also in the flyer. And then also I put some other information with regards to a Darkness to Light Stewards of Children Child Sexual Abuse training that we are authorized to deliver to adults 18 and over, meaning professional service providers, parents, guardians, caregivers, or any adult that is in a role of responsibility for protecting children from childhood sexual abuse and other abuses. The information is in the chat. Feel free to reach out to me, T. Thaddeus Brown at phoenixhouseny.org. All of the information is there, and we can try to explore how we might be able to bring that training to your organization, staff, and even your participants. And
Thank you so much, Dr. Brown. And we have.
And I just wanted to say, Wilhelmina, and finally, I just wanted to remind everyone that we are still in the period of adverse childhood experiences awareness, and all of the intersections of childhood adverse experiences and how that plays a tremendous impact in substance use, mental health, and lifelong health. So, you know.
Thank you so much for that. I want to acknowledge our communication director for New York, Melissa Fleck.
Hi, everyone. This has been kind of fun. I'm totally in love with this meeting, so expect to see me on a regular basis. I just wanted to do a little plug for our community events calendar that we're hosting on our website. So I did put that in our weekly e-bulletin. Hopefully everyone in this call gets our weekly e-bulletin. If you don't, let me know, I'll get it to you. But there is a link in there to post your events and your activities, and then it'll show up on like a statewide calendar that I'm hoping we can start pushing out and getting some more traffic to. So any events that you may have, check out our e-bulletin. The links are there on where to post your activities. So ideally we can make this a high traffic page and get a statewide snapshot of all the recovery fun that's happening across the state.
Thank you so much, Melissa.
Yeah.
All right.
Free promotion.
Okay. Anyone else want to chime in? We have about 6 minutes.
Well, I just want to thank everybody for coming on. I want to thank the steering committee. I want to thank special thanks to Brenda. We love you, Brenda. Thanks.
Yeah.
Thank you for all that good news you gave us today.
Yeah, Brenda.
And for New York, again, thanks a lot for allowing us this platform to continue, you know, our, this is what I call the maintenance part of the stages of change, you know, staying connected. And this is what it's all about, helping each other out, you know. I guess, and with that, anybody else? If not,
Oh, Evelyn. Evelyn has her hand up.
Okay. Evelyn. Now she don't want to talk.
Oh, there I go. There I go. I just want to say thank you, everybody, for all the information and everything that happens in this Oasis alumni meeting, which I wouldn't miss for nothing. I'm on here every month, but I just wanted to give you guys a shout out because the last month in March, the day that I was in the alumni meeting, my mom passed away.
I'm so sorry.
Yeah, and so I, you know, being and having the support and having taking my mind off the things I was going through helped me get through that. And I just wanted to say that this is not only professional, but personal. Thank you guys so much. I appreciate you.
Condolences, Evelyn.
Thank you.
Love you, Evelyn. A great
much.
shout out to Efrain Torres. I see you back there.
Yolanda Town. Oh my
Rahim, despierta.
Yo estoy despierto, que estoy cocinando rice and beans and collard greens.
He says cocinando, he's calentando.
Qué
Thank
jodón.
you.
Hey, Ev, love you, baby.
You more.
All right, you guys, and with that, I think we are going to close another version of the Alumni Association meeting.
Great.
Please, anyone contact me, and we are looking to expand our network. We're going to come out with a toolkit for you guys. And also, we're going to be hiring 4 peer leaders that will help assist with starting our upstate alumni group. So thank you guys so much for attending. And
Silvina, another great job.
yeah, we'll see you next time. Same Zoom link, same back channel.
Can I just, can I steal 2 seconds? Wolvina, can you
Yes.
tell Malik that I'm trying to email him and talk to him?
Everybody.
Hear me? Are you on? I need you in my life. I need you in my life, sir.
Melissa, you trying to email me?
Malik's
I
very
emailed
busy.
you,
You gotta call
I
him at
emailed
night.
you, I direct messaged you. I'm looking for you. I'm looking
You
for
gotta
you.
call, you gotta call him at night, Melissa, because he's a
Melissa,
busy
okay.
man.
I'm gonna put my stuff right now in the chat. All right,
Okay.
my phone number. All right.
All right, I will call you.
All right,
tomorrow.
welcome once again to
this is
Chris
just for you,
Cece, our new
Melissa.
policy director.
Yes.
He will be doing some presentations for us next month.
All right, I
Yes,
put
I will.
All right, Donna.
I put the chat in the email to the team, so everything's done.
Everything's done. Good, good, good. Great meeting, everybody.
Excuse me, Albert. I must be Swiss cheese.
Huh?
I never get thanked.
Oh my God, Malik.
I feel
Malik.
sometimes I feel
Thank
like
you, Malik.
sometimes
Oh,
I
my-
just feel like, you
You're
know,
the best,
Like a
Malik.
regular
can I get a
star.
little bit of love every
Hold on.
now and then, Albert?
Thank you,
I
Malik.
said thank you to the steering committee. So if you don't consider yourself part of the steering committee, or you want
Malik,
to
you know you got this.
special thank you to Malik.
Albert,
Yeah,
just a
he
little
got
bit.
this. He got this.
Just a little bit.
All right,
I love you
guys.
all. I
All
love
right,
you all.
guys.
Listen, Malik,
Connie,
do me a
Connie.
favor, save the chat.
Yeah, he did. He got the
Okay.
chat.
See what I'm saying? See what I'm
She
saying?
didn't even hear you. I heard you, Malik.
Uh-oh.
I'm there. You got the chat. Just send it to us, Malik. Okay, guys.
Love you. Have a
Have
good night.
evening.
Good night. Good night, all.
I just sent it.